Right. So Nacho's going to show us today some points on the face, and we're going to focus on the stomach channel and the large intestine channel. The first point we're going to do, let's start with the stomach meridian, is stomach 1, which is a point that not a lot of people needle because it is located under the globe, right over the zygomatic arch. And the way that you can safely needle that is to put your hand on the eye with the eyelids closed, push the globe back, and then insert the needle at the midpoint of the zygomatic arch underneath the globe, just like that. And that's stomach 1. That's a great point to clear stomach heat and also a good local point for eye problems. Stomach 2 is a point in a depression superficial to the infraorbital foramen, which is approximately at the level of the third premolar in Nacho. I can feel it right here. Stomach 2. Stomach 4 is located in a depression, caudal and slightly dorsal to the oral commissure. And we'll be right there. Is a good point, a local point for face and mouth problems. You do need to be careful when you needle that because if they lick, it's easy for their tongue to swipe over it and snag the needle and swallow it. So we're going to be monitoring that one very closely. Stomach 6 is the one that's in the center of the masseter muscle and is a very good point for temporomandibular joint pain as well as face and mouth problems. So those are all of the points on the stomach meridian that Nacho's going to show you on the face. Let's move rostrally and show you another point here that's a little sensitive to needle, but it's an excellent point for not only GI problems, but sinusitis and rhinitis in the cat, and that's large intestine 20, which is in a depression just at the border of the haired and non-haired skin at the edge of the nasoplanum. So let's summarize these points for today. Stomach 1, midway between the medial and lateral canthus in a point over the zygomatic arch and under the globe. Stomach 2 in a depression superficial to the infraorbital foramen. Stomach 4 in a depression just caudal and slightly dorsal to the oral commissure. Stomach 6 in a depression in the middle of the belly of the masseter muscle. And large intestine 20 at the border of the haired, non-haired junction, lateral to the nasal planum. Thanks again, Nacho, for showing us these points. We'll see you in the next video.